Hey guys, it's Anika from Combat COVID here. Today I'll be talking about testing for COVID-19. Specifically, I'll be discussing antibody testing and swab testing. The most common type of nasopharyngeal swab, or a swab that goes through the nose to a region known as the nasopharynx, uses reverse transcriptase PCR, also known as polymerase chain reaction, to detect the virus. This gold standard test uses a version of PCR which is usually used to amplify DNA, to detect the RNA expression of SARS-CoV-2. Most RT-PCR assays target one or more of the following genes: the E gene, which codes for the nuclear envelope, the N gene, which codes for the nucleocapsid, and the RNA-dependent RNA polymerase, also known as RD-RP. Now that we have some basic information about the test, let's discuss its accuracy. A study of 70 COVID-19 positive patients in Singapore presented the following results. When all of the subjects were given one test, 88.6% of cases were detected. After two tests, 95.7% of cases were detected, and after three tests, 100% of cases were detected. These findings indicate that the test is quite effective in diagnosing COVID-19, but it is important to keep in mind that the sample size of 70 was relatively small and more supportive data is necessary. Another factor to take into consideration when discussing various testing methods is the time of collection or testing, which can influence clinical sensitivity. In an epidemiological context, clinical sensitivity refers to its ability to correctly identify patients with the disease. Data reveals that the swab has approximately a 20% false negative rate, which means that the test returns as negative 20% of the time the patient actually has the disease. If the test is done soon after symptom onset, the sensitivity is the highest, providing the most accurate results, as you can see in the diagram. Now, let's shift our discussion to antibody testing. One of the main factors that distinguishes antibody testing from the use of nasopharyngeal swabs is that swab-based molecular testing is used in earlier stages for diagnosis, while antibody testing is used later to detect exposure and monitor infection, as it has the highest sensitivity after 20 days. Regardless of which test is used, there is always an eclipse period following exposure, because it takes time for the virus to multiply. Other uses of antibody assays include determining the stage of infection, monitoring rates of reinfection, because antibody levels increase during this time, indicating herd immunity, and monitoring vaccine efficacy. So how does antibody testing work? Well, there are 5 isotypes or classes of antibodies: IgA, IgD, IgE, IgG, and IgM. In the case of the novel coronavirus, antibody tests and assays measure to see if you contain the IgG antibody. A common question is if the presence of antibody means that the person is immune to COVID-19. Current research suggests that their presence indicates exposure to SARS-CoV-2, but not enough research has been done to conclude if immunity follows as well. One drawback to antibody testing is that it may produce false positives. As the name suggests, false positive means that the patient does not actually have the disease, but the test shows that the patient is positive because their antibodies may have been produced from a different coronavirus. If you enjoyed this video and would like more updates about the novel coronavirus, make sure to like this video and subscribe down below. Thanks for watching!